Hi, Mike Erlob here, back pain specialist for over 22 years. And I'd like to talk to you today about what is lower back pain and sciatica. So lower back pain is one of the most common complaints that we see in our clinic. And I'm going to show you a little bit. I got my friend Bob here. And so lower back pain and sciatica describes any irritation or pain that's occurring from the lumbar spine or pelvis and hips. Often this causes a pinching of the nerves or the sciatic nerve, which is the largest nerve coming down the back of the leg. So that becomes irritated, it doesn't move as well, and that causes pain. It goes down the leg. Causes of lower back pain can be from herniated discs, can be from bulging discs, can be from arthritis of the spine, could also be muscle strains and spraining of the ligaments. It could also be from what we call spondylolisthesis, spinal stenosis, which is narrowing around the spinal cord and nerve roots, bone spurs. All of these kinds of problems, including sacroiliac joint problems, can lead to lower back pain, and if it starts to travel down the leg, sciatica. So the basic cause for all of these conditions occurs from hyperactivity of the psoas muscle. So the psoas muscle is this muscle that comes from the lumbar spine and the sides of the spine. It actually travels down and it connects with what's called the iliacus. So this muscle is the psoas, the PSOAS, and the iliacus, which fills in this pelvis, comes through the lumbar lower abdominal area, then actually passes through around the groin and attaches to the femur. The job of that muscle is to actually bring your hips up, bring your leg up, so we call it a hip flexor. However, because we sit so much throughout the day in our lives, that muscle becomes shortened and becomes what we call hypertonic. So it becomes really tight and then tends to create compression on the spine. In turn, on the back side, what happens is because of the excessive sitting, because of the excessive activity of the psoas muscle, your gluteal muscles, so the gluteus maximus, the old butt muscle, it actually starts to shut off. It becomes weak and it doesn't stabilize the lower back like it should. And then also you have another muscle in here that fills in this side, and it runs alongside the vertebrae, across the ribs, and along the top of the pelvis. We call that the quadratus lumborum. The quadratus lumborum tries to counteract for what's happening with the psoas, and it goes into a spasm, becomes hypertonic and very tight too. All of these things then lead to the increased pain, pinching of the nerves, pain going down the leg, increased irritation, wear and tear on the spine. We call these imbalances. So you have this weakness, which leads to tightness, which then that leads to imbalances between the front and back. And these imbalances is what leads to chronic pain, irritation, inflammation, early wear and tear, early compression and wearing of the discs, formation of arthritis, all of those things which cause lower back pain. So many people, they will feel that they have pain in through just their back, but also they'll have pain that travels down the leg. So most of them, I'm going to set Bob right here. Most people will start experiencing difficulty with standing, walking, pushing, pulling, reaching and lifting. All of those things become limited and more painful. This affects a person's ability to be able to go shopping with their spouse, go grocery shopping, do yard work. It limits a person's ability to go traveling. They're not able to go to their kids' or grandkids' games because sitting in the bleachers without support just increases their pain levels significantly. They have trouble sleeping at night. Many times this pain then continues to stay irritated. They're not able to sleep through the night. This leads to people feeling frustrated, angry, irritated, often leads to that loss of self-confidence because you just can't be there for your family and friends. And many people have tried a lot of different treatments, ointments, chiropractic treatment, massage therapy. Some of you may have just tried just simple exercises and stretches that you find online or on YouTube. Medications, injections, and even surgery. Most of these, if they don't address the imbalances, they just don't work. You might feel good for a little while, but as you probably have experienced, that pain then returns. So fixing lower back pain and sciatica, you have to address these imbalances. You have to address the hypertonic psoas, so you have to get that hip flexor to shut off. Then you have to actually get your gluteal muscles to turn on. So you have to get them more active. Then you have to get the quadratus lumborum muscles to also turn off, and you have to rebalance that entire system. You can also should definitely start addressing any nutritional issues. You see, chronic inflammation occurs because the body has become too acidic, okay? And when the body is acidic, meaning the pH of the body is below 7.4, you can't heal. And lots of foods that we eat in the standard American diet make us more acidic. But there are some things that you could start doing right now, common household items that you have in your cupboards that you could start taking right now, which would help your body to heal. One of those is garlic. If you just increase your intake with garlic, that's an alkalizing type of food. Celery is excellent. It helps raise the pH, helps alkalize your body. And then lemon, use lemon with your water. It's also very great at alkalizing the body. So if any of this was useful or meant anything to you, please comment below, like, and share this with your family and friends. I'll see you soon. Thanks.